Well, as we've been doing since COVID-19 hit our shores, of course, we've been getting some updates from the various provinces. And we know that KwaZulu-Natal in particular has been quite open about having their responses to the pandemic. As we speak, Premier Sihle Zikalala is giving his update, a weekly update on the COVID-19 concerns, amid concerns about the increasing number of infections in the province. We're taking you there now live.
Will have to get tested. If you test too early before having symptoms, you are likely to get a false negative result. There is also a stigma against healthcare facilities. And we have also noted the increasing stigmatization of our healthcare facilities. Some people seem to have this false belief that if you go to hospital, you will die. That is not true. Our healthcare workers are bravely fighting this disease, often placing their own life at risk. And many people are getting discharged and recovering after receiving treatment. Now is not a time for fear, but for all of us to spread facts so that we can foster a better understanding of COVID-19, including how it can be prevented and how to access help for those who are affected. Given the rate at which our infections are growing, we have to do everything possible to save lives. One of the things we want to emphasize is the importance of people to be quarantined or isolated at a government facility. With enough capacity, we're urging COVID-19 patients to come forward and be quarantined and or isolated at these facilities that have been made available by government. This will help ensure that patients are well monitored and less likely to transmit the virus to others, unlike when one is at home. And when you are in the government facilities, it is where we will be monitored that we adhere to safe protocols that will help you improve. We have 16,401 beds available in KwaZulu-Natal, of which more than 3,000 are for self-isolation. We also decided that instead of building more quarantine sites, we should be able to hire buildings such as hotels, B&Bs, and lodges. Out of those, we have 11,833 beds that we can use. We also have 1,162 quarantine beds within our own buildings as government. With regard to hotspots districts and local areas afflicted by COVID-19, we want to indicate that all areas are affected. But we have decided this time to make known every district, sub-district, and townships that appear to be more bearing the most brunt of COVID-19. We are hoping that this will make people realize that this virus is close to them without stigmatizing any area or areas or making other people feel too safe from it. In this regard, we hereby announce that the search is continuing, with eThekwini and Umgungundlovu district recording more than half of the daily cases. The province has contributed 27% of the new cases reported nationally and continues to be the fourth highest countrywide. It will be remembered that at some point we were at about 12%, we went down to about 8%, but now we have shot up. We are at 27% of the cases nationally, and that should send a message that the storm is here and all of us must take a full responsibility and be responsible of ourselves. A week ago, we had 40,045 positive cases, of which 2,574 were still active. We also had 2,758 new cases and 11,055 recoveries. As of yesterday, KwaZulu-Natal has had 60,602 positive cases, of which 38,663 were still active. Sadly, we once again had new deaths this week, bringing our death toll to 614. Our daily COVID positive cases are peaking at a faster rate. We've entered the daily average of over 3,000 infections from just above 2,000 last week. We've observed that just yesterday alone, we recorded 3,405 new cases. This therefore means that in just 1 week, we have had 20,557 new COVID-19 cases, 198 new deaths, and 10,196 additional recoveries. Our recoveries to date as the province, when it's put together, it stands at 21,251. We have provided a breakdown of cases per district. In eThekwini, all wards have recorded infections and continue to record infections on daily basis. But the worst is in Umlazi, KwaMashu, Phoenix, Chatsworth, Inanda, Newtown, Tongat, Pinetown, Westville, and Tuzu. Those are mostly affected areas. But there is not even a single ward which will say it is not affected. In Umkungundlovu, Umsunduze, all wards are affected. It depends on numbers, where you will say in this ward the numbers are higher than others. That include also Mpofana, especially the Townville, Mkambatini, especially in Maqongo, and Richmond, Thornville. In Erikwala, all municipalities and wards are affected, but the more numbers are in Umzimkulu, local municipality. In King Cetshwayo, all wards are recording infections daily. More numbers are in Umlalazi, Nkandla, Umhlathuze, Umtonjaneni municipalities. And even here, for instance, in Umhlathuze, Ngwelezane Township, Jablani, Machana, and Kalakabusha are the most affected areas, with even Ngwelezane, with even Kalakabusha Correctional Service being correctional center being affected. Ilembe, all wards are affected, but the concentration is in KwaDukuza and Mandeni. But that does not mean Maphumulo and Ndwedwe is not affected. They are affected, but the high numbers are in KwaDukuza and Mandeni. In Uku, all wards are recording infections, and more numbers are in Potchefstroom, Gamalake, Margate, Machisini, Nzimakwe, Harding, and Scottburg. In Umkhanyakude, infections is reported in most of the wards, not all wards, but the highest area that is reporting the highest numbers is Hlabisa. In Umzinyathi, all wards are reporting infections, but the highest is Umvoti, Pomoroy, Nhlanhleni, and Umsinga areas. Zululand, all wards are recording infections, with more infections in Abaqulusi municipality, especially Mondlo, Vryheid Town, Bekuzulu, and Hlobani, Edumbe, Paul Petersburg as a town, and etholakele. Ceza area, Pongolo, Ncotshane, as well as KwaNongoma, KwaDabas, Mapopoma, Nongoma Town, Usuthu, and White City. In Uthukela, all wards are affected, with more areas that are affected being in Alfred Duma, which is Stedville, Acaciaville, Inkosilanga Lubalele, Phangweni, Section C, CBD, Bhekuzulu. Amajuba, all wards are affected, but the high numbers are in Newcastle, Osizweni naseMadadeni, followed by Madlangeni and Danhauser. And in Danhauser, it's a Danakol and Shepston Lake. We wanted to present these details, but we should never create an impression that there is an area that is not affected. All areas are affected, and we must understand the peak is here, and this battle now, it's with us, and we have to navigate the battle together. We will also, we will, as of next week, provide ward breakdowns in each district. In terms of distribution of cases by reporting date and district, of the 3,405 new cases recorded by yesterday, eThekwini district has recorded 53%, followed by Umgungundlovu at 9%, and Umgungundlovu remains the second highest district with COVID-19 cases provincially, and they are followed by King Cetshwayo and Amajuba. eThekwini district has been receiving a median of 834 cases daily since the beginning of July 2020, while Umgungundlovu district has been receiving 292 cases daily since the beginning of July of this year. King Cetshwayo district is now the third highest, and they have overtaken Ilembe, and they've been reporting an average of 126 new cases. So it will range from 49 to 266 since the beginning of the month. The district is also the third highest in death toll provincially. Amajuba district has been receiving a maiden number of 862 cases, and that is a lot from July, from the period of the beginning of July. In terms of the cases provincially, eThekwini, this week alone, we had 1,796 new cases, and the total now of cases in eThekwini is 30,074. Deaths are at 345. Ilembe, new cases 104. The total cases is 2,637. Deaths are 19. Umgungundlovu 312. And the total case, that's the new cases for the week, and the total cases is 915, and deaths are at 85. Uthukela, it's 143 new cases within a week, and the total number of cases is 2,804, and deaths are 30. In King Cetshwayo, total number of new cases is 251 in the week leading to yesterday. And the total number of infections stand at 4,188. Deaths are 50 now. Ugu, 204 new cases in a week. And the total number of all cases, positive cases, is 2,424. Deaths are 15. Amajuba is 258. The total number is 3,110 and the deaths stands at 19. Mkanyakute, the new cases within a week is 45 and the total number of all cases is 687 and there has been 10 deaths. In Herikwala, the new cases in a week is 66. The total number of cases stand at 1,390 and deaths are 17. Zululand, 106 new cases in a week and the total number of all cases is 2,095 with 16 people who have died because of this pandemic. Umzinyathi, 88 new cases for a week and 1,299. It's a total number of cases and 8 deaths. There is not even a single district that has not experienced a death-related case now. And that tells you that the spread is all over. The impact is in each and every district. We give a breakdown in terms of incidents per 100,000 population. We are going to provide that with a statement. The laboratory status in KwaZulu-Natal, although KwaZulu-Natal is currently the 4th highest